Good morning. This is Dr. Gabriela Romero. We are going to be talking today about digital dentistry. I have created a video with the whole workflow for Plan Meca, which is the software that we are going to be using in University of Florida DMD. However, today I'm going to be explaining a little bit of things that I had not taught before. First of all, we are going to be explaining what it means CAD/CAM, which is computer-aided design and computer-aided manufacturing system. This is something that was developed at the beginning in history 20 years ago. And overall, it is related to scan whatever prep we have completed, design the crown, the onlay, veneer, bridge, the implant, whatever we have decided to design, and then we are going to mill in-house. Or we can send to the lab the milling. We can expect the lab to do this within 2 weeks, and it can be done in 30 minutes in reality, the design, but to mill it and to send it to you, depending on the lab, it can go all the way from 24 hours to 2 weeks. We have the closed systems, and we have also something that is known as open systems. So in reality, when we talk about closed systems, it's pretty much the system that was developed the very first time. The one that we have right now is the new version of that, but in the past, CETIC is the actual system, and it was developed by Sirona, nowadays known as Dentsply Sirona. CETIC stands for Chairside Economically Restoration of Aesthetic Ceramics. It was created with the intention that it is completed the composite or the ceramic indirect restoration in the same hour, in the same 2-3 hours of the first appointment. We don't have to call back the patient for a second appointment. That was the idea, that we don't have to send to the lab. However, over the years, the dentist started to expect that labs also help them to do the milling and not necessarily the dentist to do it immediately in the same time that they are doing the scanning. If you have a lab in the same office, you can do the scanning, the milling, and then you can wait, probably go to another room, see another patient while you have your lab technician in your own clinic doing the design for you and milling for you. And then you come back to the room just to cement. Well, as you can see here on the screen, you have the Prime Scan. This is a touch screen. Is very easy to be used. It is the first one used, and therefore it is known as closed system. Why it is closed? Well, because they do not let to import STL files or any type of file from another software to be able to design in this one. If you start scanning with this one, you have to finish with this one, the whole workflow, the whole design, the whole milling. And if you want to do OmniCan, that was the older version of this. It is, I did not bring a picture for that, but it is in some offices, it is still present. It's very old at this point. It has a little ball in the center of the touch screen area, and the little ball is pretty much the mouse, However, this one doesn't have the ball, but it does have a flat surface that can be cleaned, that can be disinfected, and it is something that it's way better than before. And the touch screen in this big screen, it is amazing. You don't have this one in DMD, but you're going to most likely use this in corporations whenever you graduate and you're going to start working. I would express my interest about this. It's wonderful. The whole design can be done in just probably 5 minutes. The workflow for this one is known as acquisition, model, design, and manufacture. It is the same thing. All software are the same. You need to acquire, you need to scan, you need to then prepare the model, either cut the pieces that you don't need, cut the noise, maybe the tongue, maybe cotton rolls that have been in the scanner, in the scanning image. And then you do the design, and then this system, SEDEX system, calls the milling as manufacture. And it is pretty much the same for every system. You just need to know where are your buttons, what are your icons, and what means each of them. Open systems that we are going to be in contact with in DMD is going to be PlanMeca, and indeed this is a new update software of the previous PlanMeca Emerald, and it looks totally different and it actually behaves different. It is kind of a combination of SEDEC and Trios, which is another software. You have all the settings on the right column and they are grayed out depending if you're at the scan or if you're at the design or if you're at the milling. They are going to be pop up and not grayed out when it is time. I would say that it's smart, and I would say that it is a little bit faster, the scanner, than the previous one. The software still have some glitches because it's a new software, but it is promising. And this is what we normally have in a aesthetic clinic. On the right side, you have a lot of icons that you will be able to understand. When you go into the design video that I created for you that is already uploaded in Canvas, that video has a little bit more of explanation about each icon that you see here on the right side, and you see the whole design, the whole scanning that I have recorded for you. Another system that is also open is the 3Shape Trios. You're going to have this one, and this is going to be in your clinics. In each clinic, 3A, 3B, 2A, 2B, in each clinic you have two laptops, one for PlanMeca and another one for Trios. And the Digital Dentistry on the third floor, it's going to be just for 3Shape, and Aesthetic Clinic is only going to have PlanMeca. Grad operative though, and some of you are going to have the opportunity to do some of your aesthetic cases with the residents, you have opportunity to work there with any of them, with a 3Shape, with a PlanMeca, or with a PrimeScan. You may not operate yourself the PlanMeca, the PrimeScan, but you will be able to see the whole workflow from beginning to end when you share a case with the residents. The 3Shape Trios, it is, I would say, that the easier and the faster scanner. I would say that is the most accurate scanner. The design, though, is not as good as the design in the previous PlanMeca Emerald design. And I have hope that Planeca is going to get better the design software that they have just created, and is going to be much more detailed as it used to be before. These three shape trios, it's for the whole thing. It is for scanning the prep, it is for milling, it is for designing, and it can also be to do other things. Like, for example, remember this model that I created for you to have a full 3D diagnostic model that you can study for doing the number 30 MOL prep. Well, this was created with a 3 shape. You scan and then you do automatically, you do this base, automatically you mount it as a bite, and automatically you can play with it in 3D. I'm not going to do it today because you already have seen this model before, and the idea is that you know a little bit more about digital dentistry in UF. This is the way that it looks, the software, and is again the same thing. You're going to have a lot of windows. You're going to have a basic workflow, which is scanning, which is analysis of the model, which is then the design, and then how to send this out. It is called an open system because you get from here you convert this scanning into a STL file, and that file can be sent out to any lab that has the system 3 shape to receive, or it can also be given to you can export this STL file and you can do 3D printing. You can also maybe import in Planeca and continue doing the design there, because those systems are open, are interchangeable if you wanted to do that way. You can use many systems to mill and many systems to design, but you will not be able to use, for example, CEDEC with this one. CEDEC is just CEDEC because it's a closed system. Other things that you can do here is analyze the bite, analyze the before and after, analyze, for example, if you see your patient have erosion, then you can observe and with a lot of detail whether or not the erosion lesions have been increased in size. You can also do any scanning to analyze your own prep and to analyze if you have undercuts or if you have the good whole criteria that you need to know. Okay. Besides that, you also can use those systems for shade selection, which is, I would say that the best is the eye, the human eye, but in case that you want to try, you can do the shade selection in any of these systems. Diagnostic digital impressions are also capable of being done, and you will be able to scan and then 3D printing, or scan and then at least see in the actual screen how your bite is, how the wear facets are, how the patient bites, and everything related to the cast models. Instead of seeing it in analog phase, you're going to see it in the screen. Diagnostic tools for any type of prep analysis, as I mentioned previously. You're going to be able to observe if you have enough gingival clearance, enough occlusal clearance, if you have sharp angles, if you have undercuts. And with these systems, you're going to be doing any permanent or provisional restoration. You can do crowns, you can do veneers, you can do Maryland bridges, Carolina bridges, inlays, onlays, overlays, bone lace, crown lace, everything related to lace. And you can also do implant supported single tooth crowns. As you can observe here, we have blocks for that has a little tiny hole opening here, and this hole is to be able to, after you do the milling of the provisional, you are able, or the permanent restoration, you are able to cement to the base, to the very base, or to an post impression that you are going to have separate, and you can deliver a provisional implant crown, or you can deliver a permanent implant crown. If you do, for example, this system, this is known as IMAX CAD, medium opacity, and it is used with this system, something known as scan body. And when you're scanning, you have to let the scanner know that you are not doing a diagnostic scanning, or you're not doing a crown prep scanning or a crown onlay, but you're doing a scan body impression. So it is a little bit different. You are going to most likely be exposed to this before you graduate. And just keep in mind that those are scan bodies, and you need those if you want to have a provisional restoration. And if you want to have a permanent restoration, you need to have a vario base or a T base. And you need to cement the crown outside the mouth and then the implant crown. And then you're going to get the implant crown in place, already cemented to the abutment. You can also use blocks that are made of resin and a little bit more reinforced with ceramic, and they look beautiful. You can observe here how amazing they look. They are not going to be as strong as ceramic, but they are really having other indications and other advantages. For example, you have also the Enamic CAD CAM, which is from the house Vita, and the previous one was from the house 3M. And either or, because they're resin, they have some advantages, and the same advantages than when you do any type of indirect restoration, not necessarily chairside, but it will have the same type of occlusal wear than the opposing teeth, because it has enamel-like wear properties. You will also reestablish a perfect contour and a perfect contact, because you will be able to design exactly what you want. And in case that you have difficulties to do a direct posterior composite, you can also use it. One of the advantages of these blocks is mainly done by resin is that they can be milled in thin layers. Therefore, the milling is faster, and they are more conservative. You don't have to do a lot more reduction. You will have less wear of the milling burrs of your milling machine, that when you have your own office, you will probably want to save some money. So they have their indications. They're easy to repair because they're resin, and they're easier to cement because you don't have to do the whole protocol that you will learn at the end of this module. The resin composite blocks also have certain specific indications, and I would say that when antagonist is not ceramic, that could be one of the best indications for this type of blocks. When patient requests a more similar bite to the actual bite that the patient has, I think is also good, because composite bite blocks, these blocks are going to feel a little bit more comfy to the patient when they bite. They are not going to feel they have a stone. Even though you do the best occlusion in ceramic, they are going to feel in somehow that they have something that is not the same comfortable than dentin or than enamel. It's not the same. And for those that has had a crown and they have had a ceramic crown or a composite crown can tell you, I like better the composite. But the problem is that it wears faster, of course. And if you want to stabilize a tooth that has had a cracked tooth syndrome or has a cracked tooth syndrome or have cracks, line of cracks or crease lines that you can palpate, then any indirect restoration will be able to protect the tooth. Of course, if you also protect or cover the cusp. We have some blocks. The name is Celtra. They're brand new. I would say they're the newest in the market, and we have some residents in Grand Operative that are doing research about this. They apparently are more aesthetic because they have more glass than Emax and Empress that you probably have already heard about those. They apparently has opalescence characteristics and also fluorescence characteristics and what is known as the chameleon effect, that they say that it's very difficult to observe where the inlay or onlay margin is with respect of the tooth structure. They have a very good flexural strength. If it is milled only, it is 200 megapascal. But if you fired after you mill it, it would increase a lot, almost double. It will increase to 370 megapascals. So it's a pretty good compressive strength and it's a pretty good material to be beautiful. You can take a look here how it looks. And then, well, I'm going to be showing some pictures and explaining this because I have noticed my students graduate without understanding this and without having probably a place where to go and where to come back to remember what is each block about and when to use one and when to use the other. This, for example, is the TeleoCAD. This is from Ivoclar, and you can see that you have two different sizes. The large size is the B40. This is for, it can be reused if you use it in the CETIC milling machine. Not in Planeca, but yes, in CETIC. And you can, for example, use it and mill one crown, and then you can reuse it and do another crown, for example. And you can also do a bridge. You can mill several units from one block. The TeleoCAD is also a material known as PMMA, polymethyl methacrylate, and it has a very good flexural strength. It is about 130. It's very strong. It's very beautiful, very easy to polish, and the gingiva, when you want to have a heel gingiva, when you don't want the provisional that you normally do will trap plaque, and you want to have a perfect polished provisional that is going to help you to heal faster so that you can cement easily later on without bleeding or without the problem of gingival clavicular fluid from inflammation, then that's a good choice. It's very good to indicate this. The problem is that it's expensive, but I would encourage you to try. You can see that you can also have this type of block. When you see a hole, is because those are implant. Those are for implant crowns, and they are provisional material. Let's take a look here. You see that they look very much the same. They are Ivoclar, both of them. Yeah, all of those blocks are Ivoclar, but the difference in color are almost nothing. This is A3, this is A2, this is A3, this is A3. So you have the TeleoCAD. You can also have another larger and longer block, which is the B55. This is smaller. But in regards to the colors, they look the same. However, this is PMMA and this is resin. The tetric is resin and the teleocat is PMMA. So just for you to know that when you are going to be working, you can get confused if you don't know what you have in your hands. Also notice that they have different attachments. This attachment is rounded. This is for the milling machine for the SETIC. And this attachment that is kind of hexagonal or triangular with some weird square shape, this is for Planica. And we have many different type of blocks for both of the machines. We also have another type of block, which is Empress, and Empress is a Leosite reinforced glass ceramic, and it is a beautiful ceramic. You have different type of translucencies. I'm sorry, not radiolucencies, it's translucencies, and the Empress can be high translucent and can be low translucent. High translucent will be that you have a high pass of light through it, meaning that it will let pass the color of the substrate. So if you have a dark substrate, maybe this is not the right choice because it will be showing the dark substrate unless you change the color of the cement. Remember that we can have neutral color cement, and this is the one that most likely we use when we don't want to change the dark substrate of a crown, when we don't want to hide that dark substrate. And you can also have a low translucency. The low translucency most likely has less glass. It is translucent, but it is less translucent than the high translucency. And it is made most likely, the low translucency, it is made most likely for posterior teeth because you need to have more strength, and because you don't need to have much of aesthetic on the back. More aesthetic is needed always on the anterior teeth. You can observe here, for example, our onlays that we are going to be cementing at the end of this week is going to be done with these blocks, with Empress. And the good thing is that you're not going to need to do firing. You don't need to crystallize this face. It is not necessary. So once that is milled, you can cement as it is. You can observe here, for example, that they are very similar. It's very difficult to make a decision. What do we have in our hands? If a block for resin reinforced ceramic, or if a block that is Leosite reinforced, or if it is a lithium disilicate ceramic block. For example, those are easy to identify because they are purple color, lila, slightly bluish for the implant one. This is for the medium opacity, and this, for example, is LT, that means low translucency. And you can also have high T, high translucency, and MT, medium translucency. So different translucency for IMAX, which is lithium disilicate. Observe also that the size of the blocks can vary. They can be a little bit smaller, which are mainly they are mainly for premolars or tiny teeth, anterior teeth. And the larger molars, it's more with a larger block, like for example the C14. You don't see here the C, but the name here is C14. So all of these sizes of blocks is something that you need to know because you need to choose this before you make the milling. You need to choose this and click on the right setting before you mill. For example, also that is maybe something important for you to know is that if you decided to use a I-12 block, that normally mill in about 8 minutes. And if you decided to do a C14 block, it lasts a little bit longer, like around 14 minutes. So this is more for a large restoration. But sometimes if you have a molar but you have an onlay instead of a crown, then sometimes you can go for the I-12. You can also have IMAX zirconia, which it looks a little bit whiter, and you have the lila color as well. So those are from Ivoclar House. And when we talk about zirconia, or when we talk about IMAX zircad blocks, I want you to use the correct words. We sintered IMAX zirconia, but we crystallize IMAX, this one. We crystallize IMAX lithium disilicate. They both are IMAX, and they both are from Ivoclar, but they are different in materials, of course. One is made from zirconia, the other one is made from lithium disilicate. One is lithium disilicate is also a glass ceramic, and it has less glass than Empress. And Empress has less glass than feldspathic. We will see a little bit of those examples in future pictures. So far, the zirconia IMAX, it takes a little bit longer to mill. That's one of the maybe disadvantages. And also, even though they are working in doing a lot of more aesthetic zirconia, zirconia can be milled in thinner thickness, which is very good for those cases that you don't have enough occlusal space, occlusal clearance. And it's also good for those patients that are bruxers, but you are going to invest more time in milling, and the milling, it's not going to be in the regular way as the other ceramic. So you should have a milling machine just specific for zirconia because it's dry, the milling machine, and the wet machine, it's for glass ceramic. So if you mix them, you have to change the burrs in the milling machine, and it takes time. And it may create chaos because it's not a good practice to have one only milling machine to do both, because it's not good in time to do remove the burrs and put on the burrs and remove the burrs, because they use different burrs. As you can see here, you have the C14 versus the C17 size of the blocks, just for you to know. Okay, so you have C14, you have C14. They are smaller than the C17. So keep that in mind when you're going to choose your blocks, and choose accordingly. So if we see here these many blocks, they are different colors. I think you are all going to remember that the lila color, it's IMAX, and the regular color, either A3, A2, AB, B1, whatever color, but it is tooth color, that it's more for Empress, or for Teleocat, which is a PMMA. But now here, how do I know which one is one? How do I know if this block is made for CEREC or if this is made for Planeca? Well, this one is, I already discussed this with you, that when you have an hexagonal or triangular shape thick base, that is for Planeca. And if you're going to do if you have this connector, which is a circle, which is a cylinder, then this is for static machines. There nowadays we don't have it in UF, but just know that we can also use feldespatic CAD/CAM blocks. It can be done in very thin layers, and it is easy, of course, to fracture because feldespatic is the one that has the highest amount of glass. But it exists, and some labs do it. And it looks nicer, of course, because as you can tell, the only ceramic that has the most optical precious characteristics is the feldespatic. You can also have feldespatic veneers, CAD/CAM, and they can be milling in 18 to 20 minutes. Very thin layers, but those feldespatic veneers, you can also have what is known as a cutback technique, and you will see in the next one. This type of feldespatic veneers in this type of blocks, they are stained. They are not adding up a feldespatic pressed porcelain, but they are going to have staining. And by staining, you can actually do translucencies, and you can do radiopacities, and you can do a little bit of different layering in colors. This is one lab that does this, for example, and other labs can do feldespatic layered on ceramic. The base core ceramic can be zirconia, for example, or it can be lithium disilicate. And then you add whatever is missing here is where you're going to add of feldespatic. This bilayer or this layered porcelain is not really recommended because it can chip. It can crack slightly. But if you use this for a patient that is not a bruxer, for a patient that has a perfect class 1 angle of occlusion, then it will be okay. If you have a patient, literature review says that if you have patients that have a class 2 angle of occlusion, class 2 skeletal, that the patient has to have a very deep bite and has to have a lot of stresses on the molars because they do not disocclude because they don't have anterior guidance or if they don't have a canine guidance. In all of those cases, you have to be better you have to understand that it's better not to have a feldespatic and not a feldespatic layered either. If you do this type of ceramic, which looks beautiful and apparently has some benefits, I think it's better to have an eye guard placed on this type of patients. So, for example, you can observe that this technician started to add some layer feldespatic on the top of the core, and at the end, look how beautiful they look. And you can observe that they have certain, it's not as beautiful as just feldespatic itself, but it's very different. It's beautiful. And it's nicer than staining only. So you can also have, for example, a wash liner for fluorescence. You can add a little bit of porcelain feldespatic on the actual CAD/CAM block that has been already removed all of this shape to be able to have a core and then to be able to have the aesthetic. So trying to have strength and trying to have aesthetic. This is some labs that want to do this way. Well, so this is the plant mill. This is new. We just received this one a week ago or 2 weeks ago. And as you can see here, you have a square, diamond, rhomboid shape. And this is for the rhomboid shape of the blocks. So this is pretty much for Emacs in this case. And this is for Plant Mecha software, Romex's software, the one that we are going to use this coming Friday for you to design your own restorations. You also have a plant mill, old fashioned. This is the previous version. They are amazing. They have worked a lot for us, and they are easy to follow. You just need to see the screen and pretty much read what the screen asks you to do, and you do what they say. I have here a video so that you can see a little bit of what it means and the noise that it makes. So you will have here the name of the patient. Well, we have a little bit a glitch right now going on that we don't have the name of the patient, but it used to be like that. You have the name of the patient. Observe here, this is the little block, and those are the birds. Something that is curious is that this machine, the old one, has 2 burrs, and the new one has only 1 burr. You can observe how it mills super fast. It can be between 7 to 10 minutes if it's an only in the new machine, and it can be 14 minutes in the old machine. For example, this one is Empress, the other one was Emacs. You can see the difference in colors, right? Well, after we do all of this, then after we have the milling of the Emacs, not the Empress, of the Emacs, then we go to the other lab to do the crystallization. Remember, if we talk about zirconia, we talk about sintering. If we talk about Emacs or lithium disilicate, we talk about crystallization. So this firing machine or this oven or whatever way you want to call it, it has different settings, and same thing, you just have to read what you have here. You have P1, P2, P3. The one that most likely we're going to use is the P3, okay? And this is the prime mill. This is the new machine for the SETIC. This is the new milling machine for the prime scan. You are going to have this machine also next to the Planneca. We are going to have all of them together, but this is not the one that we are going to use unless you are in grad operative doing an aesthetic case. Okay, observe that this is not a hexagonal or a rhomboid or diamond shape. This is just a circle, and this is a circle, a cylinder. So those blocks goes in here. Then you remove it once it's completed, the milling, you remove it with a wrench. You place something known as ceramic firing support. This is like sticky white stuff that you place underneath the intaglio of the onlay or the crown, with the intention to support the ceramic so that it does not fracture, and with the intention also to protect the whole ceramic restoration. Once that you place it, you have to clean all the margin very carefully with a macro brush or with a brush or with whatever you want, but it has to be clean, because if you don't clean it, then you're going to have glaze. When you're going to glaze this restoration, which is glaze, it is a spray or it is a semi-liquid material. When you glaze, then the glaze will go inside of the intaglio on the margin, and it can show at the end after the firing, it will show like crispy. So the idea is that we protect with the firing support and we make sure that it's flush. After we do this, we normally place it in a sprue if it's a crown, but if it's an onlay, most likely we don't have the sprue will not hold it. So you have to just place it at the base plate, at the metal base plate. You will see all of this in aesthetic clinic when you come. And you have the plates are this, and the sprues, no, the base, the slots are the pins are these ones. So you put a pin in the intaglio, and then you put the pin on the plate, and then you place this one inside of the firing machine, and that's it. Then you fire for 15 more minutes, and once that you get it out of the firing, you have to let it cool down because normally it goes above 1500 centigrades. Then you have to let it cool down by itself. Sometimes we want to hurry, and sometimes we want to put a lot of air conditioning in this lab, but it can induce cracks. And if it's thin, it can also crack. So it's good that we try to have a better temperature in the lab that is not too cold, or if we are going to let it to slowly cool down, we try to place it here in these areas so that it slowly cool down. And then you remove the fire support that looks like a cotton, and then you place it in the ultrasonic bath to clean it out. And then you try on the patient, and then you bring it back if to the ultrasonic bath to clean it from alcohol, to clean it from blood or from saliva before cementation. This is also another speed fire. This is super faster and it's wonderful. And this is also the ones that we are not using it. It's Grad Operative, the one that uses it. And this is most likely to center zirconia. And well, at the end, we ended up having restoration, and we add a lot of cement, and we cemented, we clean the cement, and all of the cementation protocol, we are going to have a full class for that. You don't have to worry about this for now. It's not part of your quiz, which, by the way, your quiz is going to have onlays and digital dentistry, and the lecture that I gave you, and is uploaded in Canvas since 2 weeks ago. That lecture has some important information that is going to help you for the quiz. So revise this one, review that PowerPoint, especially has some red letters that are going to be some highlights. But if you paid attention to that lecture and you're paying attention to this workflow, most likely you're going to get 100 in your quiz. And then the final is to have a restoration that it looks beautiful and not necessarily have to be done by a lab, but by yourself. So let's see a couple of cases here. This is a big case that I did a long time ago, and I just wanted to show you that this case was my first case probably that I used the TeleoCAD milling machine. I used the TeleoCAD blocks and the milling machine to perform these provisionals. The patient didn't want to come back because she loved it. She loved it also because it was comfy. It was kind of the same feeling as the regular teeth. And the most that I liked of this is the shiny surface. So the red gingiva that she had, a lot of plaque that she had, it heals a lot by, of course, good margins, but also polished and shiny margins. And this is the end. This is real IMAX CAD crowns, implants, and and well, those are before polishing, but they are CAD cams blocks. This was the occlusal picture of this case. You can tell that there is not much of layering, there is not much of different type of characterization. She actually wanted like that. She wanted white, and that's it. She didn't want any color, anything natural. She wanted that way. However, if we decided to do, for example, feldspathic CAD, we can obtain something as beautiful as this, that you can see the white halo and the radiolucency at the edges. You can see the mamelons. You can see a little bit darker color here. You see the characterization in the feldspathic CAD staining. You can also see cases like this, for example. This was a case that I had that she was referred to me to do a crown on this one to match this crown to this one. And of course, I did not do that way. I had to send the patient to ortho and to make room for me to do a nicer crown. But the thing is that this was an implant, and when you have a metal and you need to cover this, you need to cover with something that is not low translucency, there is no high translucency. You need to cover this with an opaquer. So a CAD will help, a CAD cam block. And this is the result. Of course, this is layered and it has characterization. You can see the white opacity on the edges of the white halo. You see the translucency. You see the mamelons down here. And it looks pretty similar to this one. Of course, over the time looks even better because the glaze went away. This is kind of too shiny for her own teeth. And she was a nurse. She was very busy. She never came for cleanings or stuff like that. Well, we have completed our class, and thank you so much for listening.